This is what you got to do. First of all, you've got to try to ride a bike less. Number two, you've got to, before you go to bed, you're going to fill up the tub with warm water, almost hot, and stay there for a little while. That will relax your bladder. If you have to pee in the tub, go ahead and do it. Empty the bladder before going to bed. Hot sitz-baths in the bathtub is even better. Then you have to consult to your urologist, because what I think you have is BPH, benign prostatic hypertension, and at this point you have acute prostatitis, which is the case, and sometimes there are little abscesses in the prostate, and because of that you're having the symptoms of inflammation and infection, which is rapid pulse, and you have a temperature, and on top of that, what you have to make sure is that you go into antibiotics. I don't know if you can take Cipro, 500 milligrams twice a day. I don't think that will interfere with your penicillin intolerance, but talk to some doctor about it, and if not, you have to go on the sulfonamides, the sulfa drugs, which will also take away this Biaxin, etc., etc. Next thing, if this doesn't stop, you have to get a PSA, prostatic specific antigen, which I think is going to be somewhat elevated. If it's very elevated, you have to go and have a cystoscopy and a CAT scan of the prostate to make sure that it's all benign and nothing else is in there. At this point, it's most important that you restrict your fluid intake at around 6:30 in the evening, so that at night you'll be able to rest. Once you restrict the fluid, you go to the bathroom before going to bed after taking the sitz bath, and you empty your bladder, and you'll have a more peaceful night. Go ahead and do that. That's my recommendation.
Wow, thank you so much. I'm going to transcribe this.
Now, coffee. Do you think coffee is good?